Hey, it's your old pal, Dr. Steve from Weird Medicine. Good little live stream tonight. No big deal. No big whoop. Don't really have a lot to talk about, but these go out to the patrons at Patreon first, and then they go out to the members on YouTube, and then they end up being public eventually. Hope you all are all right. Having a great weekend filled with fluids and secretions untainted by human pathogens. Anyway, I thought what we could do is answer a few questions. I had one from Patreon in here. The weird thing is Patreon is, it's pretty awesome, but the community chat, you can't bring it up online. You can only do it on the mobile app. What is the deal with this? Maybe I'm just too old school. But all these things that are mobile app only, like Cameo, you can't record a Cameo video on your computer, not directly into the app. I am on a new thing, by the way. It's called Shoutout, so go to shoutout1.com. They actually put me on the front page. I think they thought they bagged a real celebrity or something, but it's just stupid. But I enjoyed doing those things, and if you'd rather do it on Shoutout 1 instead of Cameo, it's fine. But anyway, this is an email or a chat in the Patreon chat, which feel free to join us. It's patreon.com/weirdmedicine. We have a free tier. I don't know what you can see on that. I don't really post much to the free tier, but you can do that and kind of see what we're doing, then decide if you want to join. It's not that much. It's cheap. But this is from Kim Chickens. The story about how we met is kind of funny. We were at Joe Rogan, and I was on Twitter, I think. She said, "Oh, we're at Joe Rogan too. Let's all have a drink." And so Tacey and I went and met her and her boyfriend Benton, who I kept calling him Benson and then Vincent. I couldn't get his name right, but anyway. And it was like, do you remember on The Office when Michael and D'Angelo Vickers were calling each other and they were sitting right next to each other? It was kind of like that. D'Angelo Vickers being Will Ferrell. It was a pretty funny story arc. But anyway, this is from Kim. Help hypothyroid patient continue to self-administer oral iodine supplement, 1 to 3 drops a few times a week, quote, when she thinks she's getting sick, unquote. Okay, so iodine is an essential atom. We must have it. That's why we have iodized salt, because if you have iodine deficiency, it can cause all kinds of problems. I can't remember any of them right now, but one thing that they'll do is if you, it's taken up by the thyroid, and if there's a nuclear attack, they'll give you iodine capsules. And you go, well, why do they do that? Well, the radioactive iodine cannot attach to a thyroid that has fully filled receptors. So you take the iodine orally, it fills up all your iodine receptors, the things that are waiting there trying to grab iodine. And then the stupid radioactive iodine comes in and bounces off of it and is just excreted. So it's a way to prevent thyroid cancer. That's all it really does. Iodine in a nuclear war, it's kind of it's not a joke exactly, but it gives you false confidence that you're doing something for yourself. But anyway, she takes iodine supplements 1 to 3 times a week when she thinks she's getting sick. She's prescribed 88 micrograms of Synthroid daily. So Synthroid is the branded version of of T4 or levothyroxine, which is thyroid hormone. If you have low thyroid, they'll give you thyroid replacement hormone. That's basically what it is. If your testosterone's low, they give you testosterone supplements. So same kind of thing. No permanent changes over 2 years, but has a history of medication adjustments made by a prior primary care provider during flu season when patient would dose her iodine. So this is she has a psychological fixation on the iodine, it sounds like, and she feels like it makes her better and prevents colds and stuff like that, but there's no evidence that that's the case. We'll look and see if there have been any clinical trials done on iodine preventing colds and influenza, but I don't think there are any. Prior PCP, primary care provider, no knowledge of patient long-term iodine use history. So when you're a primary care provider, and Kim she's a nurse practitioner, people come to you and they go, well, my previous doctor gave me X, Y, and Z. And it's like, you want to go, well, your previous doctor was a nut. I remember when I first got started, there was a doctor that had just retired, and this person would diagnose people with all these ailments and then miraculously cure them using goofy sorts of medications. And they would treat depression with Synthroid and all kinds of stuff. And it was really difficult to get patients to sort of accept more accepted medical treatment. And, it's one thing if you're going to a naturopath or something, they've got sort of their own philosophy about things. But when you have someone that's purportedly an allopath, in other words, practicing Western quote unquote scientific medicine, and they're doing crazy stuff, it's hard to get your patients to believe you when it's like, hey, we need to do this a different way because they're so used to doing it that way. Anyway, let me see if there's anything else in here. So, her thyroid stimulating hormone changed a little bit during this. And, what a lot of doctors will do is they only test the thyroid stimulating hormone. So it's called the TSH. It stimulates the thyroid. That's hence the name. And it comes from the pituitary gland. So if your thyroid is not producing enough thyroid hormone, the pituitary gland releases thyroid stimulating hormone, which then stimulates the thyroid to produce more thyroid hormone. And then as the thyroid hormone rises, the pituitary notes that and it stops producing TSH and it starts to fall. And so what it does is it keeps that level in this sort of narrow range, producing a little bit of thyroid stimulating hormone when it gets low and reducing the amount of thyroid stimulating hormone when it gets too high. And so if you have a thyroid that just quits producing, and here's your thyroid gland right here, if it stops producing thyroid hormone, then your thyroid stimulating hormone will go up. And if it's producing too much, as in the case of hyperthyroidism, then your thyroid hormone will be high and your TSH will be low. So we'll call those primary hypo and hyperthyroidism, hypo being low, hyper being high. But TSH isn't the whole thing. If all you test is the TSH and you go, oh, well, it's high, so your thyroid's low, you're missing the boat because there is another hormone called thyroid releasing hormone. And sometimes that's in the hypothalamus can go crazy and cause you to produce too much TSH. Or, the pituitary could go crazy and get what's called a pituitary adenoma and could start producing too much TSH. And if it does that, the thyroid will be high. So if you only test the TSH and say every time it's high, the thyroid is low, you're missing out on these secondary hyperthyroidism episodes. So I recommend in this person, or secondary hypothyroidism, So if your pituitary dies, you have empty sella syndrome, and it stops just producing TSH, your TSH will be low. And again, if all you do is test for TSH, you're going to think that the thyroid is high, so they've got hyperthyroidism because their TSH is low, but that's not the case. They're both going to be low. So you have to do a full thyroid panel at least once. So what I recommend on this lady is get her to stop taking all that shit, including the Synthroid, for 2 weeks. 2 weeks isn't going to affect anything. And then do some blood work and see where we're at. And if it's normal, then I'd get her to go 2 more weeks and see if it's still normal. And if it is, then I'd get her off all that stuff. And then if she wants to take, a little iodine, let's look and see. Let me see here if we can see. Oh, there's Dr. Scott's website, by the way, simplyherbals.net, simplyherbals.net. Here's his CBD nasal spray. $16, but worth it. And it lasts about a month. So you're talking 50 cents a day. It's not bad. I use it every day, and I really enjoy it. Let's see here. Iodine. Well, boy. Iodine overdose. Let's go there first. So iodine toxicity can lead to thyroiditis. In other words, inflammation of the thyroid and hyperthyroidism. Then it can result in hypothyroidism. And you can even get thyroid papillary cancer. So I would tell this person you're putting yourself at risk for not only hyperthyroidism, but hypothyroidism and even thyroid cancer. So let's see how much she has to take, though. Let me see. Dose. See how much you have to take. Excess iodine intake due to the unmasking of underlying thyroid. Okay, wait a minute. Yeah, let's see. Sometimes the stat pearls are pretty good because it will just distill this down to the facts. Just the facts, ma'am. Let's see here. Oh, no, this is a lot. Etiology, iodine toxicity most commonly results from overconsumption of dietary supplements. Yeah, she needs to get off this stuff. I don't know how much she's taking. I don't know what the concentration is. Tincture of iodine and betadine are topical medications used as antiseptics, can cause a rash or blistering when applied topically and will lead to more severe toxicity if ingested. So let's see here. Reported 1537 single exposures to dietary supplements with 58 adverse events and no deaths. It's not that scary. Let's see here. Yeah, I don't, anyway. No reported deaths due to iodine toxicity. Thyroid cancer, most common, steadily increasing endocrine malignancy. Increased incidence due to part to improved diagnosis and screening. That's true. But hypothesis that increased incidence may also be related to iodine excess. So I think it's okay to talk to your patients about statistics. I really do. And I think that's she needs to get off the iodine. Calculate how much she's taking, how close she is to being toxic, and then just show her the evidence. All right. I have some phone calls from 2015. I thought those might be fun to check out. I haven't listened to them, so I have no idea what these are. So let's just see.
Dr. Steve, this is Little Waller calling from Washington State.
Hey, Little Waller.
Listen, I'm calling because we've all heard the stories and warnings about if you feel generalized pain in your left arm and especially in your chest, it could be a precursor of a heart attack event.
Correct. Or a herald. Those are those are signs that you're actually having a heart attack.
I had a variation on a theme this weekend and
Okay.
wanted to ask your opinion on it.
All right.
Instead, by the way, I'm a fairly heavy adult male, 55. I'm actually on a fitness program, lost 35 pounds, and continue going. I now exercise every day and eat well, so I'm on the path to recovery.
Excellent.
But this weekend, what happened twice? I felt a very, very sharp, agonizing pain, not in my generalized left arm, but a very specific spot in my left ring finger between the knuckle and the hand, right where the wedding band would go. I haven't worn my wedding band for years because it has not fit, so there is no constriction effect there.
Mm-hmm.
The issue was not that almost immediately after feeling that immense pain right there in the fleshy part of my left ring finger, I felt an echoing sharp pain, again in a very specific localized area in the left chest, just below the breast, about 2 inches off the midline. It happened twice, 2 days. There was about 4 or 5 major specific pulses of pain, first in the left ring finger, then in the left chest, but not generalized, not a heavy feeling in the chest. Very specific, sharp pain, as
Right.
if playing mumbly peg on my hand, and
Yeah.
then the same very, very specific localized pain in the chest. So anyway, I'm wondering, if this is.
Yeah. Well, of course, this was 8 years ago. Hope he's okay. That does not sound like cardiac pain, but cardiac pain doesn't always present like a textbook either. So the textbook example is dull pressure in the left chest, radiating to the left arm and shoulder, with shortness of breath, palpitations, nausea, sweating, and those are the big ones. So, and usually, but not always, if you're having angina, which is the precursor, where you're having chest pain from decreased blood flow to the heart, that's usually associated very accurately with exertion. In other words, it happens every time you run up the stairs. Now, my dad, when he had his heart attack, he had a treadmill afterward, and they could see the changes on the EKG, and they were like, well, you're having ischemia right now. Are you feeling anything? And he said, yeah, I'm having pain in my shoulder. He would always just have pain in his shoulder. He didn't realize that was cardiac pain. There was a guy when I was in training who died in the triage unit because he came in and he said he had a sore throat. And so they put him over on the ambulatory side, said, we'll get to you whenever. When they went in to get him, he was dead. And what it was found was really going on was he was having pain in his neck from a heart attack, and he just didn't articulate it in just the right way. So they blew him off and said that he was having an upper respiratory infection and a sore throat. So not everybody presents, hey, I feel like there's an elephant on my chest and it's radiating to my left arm with shortness of breath, palpitations, nausea, and what we would call diaphoresis or sweating. This, however, sharp pain in the finger that then also is echoed in the left chest, sounds neuropathic. It is weird, nerve pain, and it could be just a weird compression where he's having a nerve that's being compressed, and you get these feelings wherever the nerve goes. So, for example, if you've heard of sciatica, this is pain that goes down the leg from compression of a nerve root in the low back. And so if I take needle nose pliers and I go in and I grab a nerve that goes to the left toe and I squeeze it, you'll feel it in the left toe. You won't feel it there. Or you might feel something there, but you'll also feel it in the left toe. Now, I'm struggling to find a neuropathic pathway that includes the left chest wall and the left finger, but there are some commingling of nerves. But the important thing is that on the left side, particularly, the heart the esophagus, the arm, and all those nerves started in the embryo at the same time, and then they differentiated and they separated. And that's why when you have cardiac pain, you have pain in the left arm as well. So because those nerves were commingled and had the same origin when we were in development. And so some of those anatomic structures are echoed in adulthood. So it does not sound like cardiac pain. If that kept up or if it became reproducible, I would absolutely get it checked out. Sometimes they can just stick a needle. If they can figure out which nerve is being affected, stick a needle in there and shut it down for a minute, and they can demonstrate to you that that's what it is. And but anyway, that's a weird one. I would have to. I've never seen anybody that had that particular constellation of symptoms, but that's where I would start. Anyway, all right. I wanted to let me do this. I was on the Creep Off, and if you're interested, this was before I knew how to transmit my audio properly, so the audio's all kind of screwed up, and I felt bad about it later because I had music, and I had David C. Robertson from DC On Screen, one of my favorite comic book movie podcasts, do sort of a Joker voice, and do, like one of these true crime TV shows where they are sort of overly dramatic, talking about the killer and all that stuff. And but the music didn't translate because I was using my mix minus. Don't worry about it. I was using the wrong system to connect to them. Now I know how to do it. It would be much better if I did it now. But anyway, this guy is a physician. His name is Michael Swango. And if you want to listen to me talk about him on the Creep Off, and I did win that week. If you're not familiar with the Creep Off, it's a comedy true crime podcast. And the Creep Off live show is one of the funniest things I've ever seen. So it's a really good show. It's Vinnie Paulino and Carl Hamburger do it, and they compete. So they have to bring the creepiest medical professional, which was the show I was on, or the creepiest mortician or whatever, and then people get to vote. And then there's a wheel of consequences, and they have to do consequences. Carl lost one time, and he had to get a picture of himself in this cow bikini that Victoria had worn, and there's too much going on there. I can't explain it all, but it's a fun show. Check it out. You got to listen to 2 or 3 of them. You get sort of the rhythm. But I wanted to just go through and talk about this guy because he was a physician and he was a valedictorian, in Illinois. He graduated summa cum laude. He was a high school valedictorian in Quincy, Illinois, an honorable discharge from the Marines, graduated summa cum laude from Quincy College. I mean, this guy was no slouch. And he graduated from Southern Illinois University School of Medicine, where his classmates nicknamed him 00 Swango. You know what that means. In medical terms, when you call someone 00 something, it means they have a license to kill. It means they're a dangerous physician. So they knew that. So faculty raised concerns about his performance, but he gets into a neurosurgery program anyway. Now, in February, a nursing student reported that he tampered with an IV, and then all of a sudden this patient has a seizure and went into respiratory arrest. The patient survived, but they suspected him in 5 different deaths in the ward. Now, this sort of sounds like, it's possible, if it was truly a seizure, it's a little bit harder to pinpoint, but, a cardiac arrest, you just inject somebody with potassium, almost impossible to detect that because with chest compressions, all that stuff, so much potassium is released into the bloodstream just from trauma that if they have an elevated potassium, you go, well, yeah, of course, they had a cardiac arrest. So Ohio State recommended him for medical licensure. He completes his internship, was not invited to stay on for a neurosurgery residency. That's not that uncommon. Some of these places will have these pyramid programs where they may have 5 residents the first year and 3 the second and third year, and then 2 and then 1, and they just are getting rid of people. So it's a really competitive system. I'm hoping they don't do that anymore. That was in the 80s. This is when I was training. So he finds work as a paramedic in Quincy. Now his colleagues start to fall ill, and they suspect him of poisoning them. They find a mini laboratory of poisons, including you can't have a recipe for botulism, but you can grow it. Botulinum toxin can be grown at home, and it is grown by people who improperly can vegetables all the time. Well, not all the time. It happens. Very deadly. Microgram per microgram, other than plutonium, it's about the most deadly substance. 3 really microgram dose deadly substances: plutonium, fentanyl, and botulinum toxin. And but they can't, they've got, he has all this stuff in his house, and he's still running around. So they they look into his time at Ohio State. There's all these suspicious stories, no hard evidence, and the Ohio State Law School dean investigates the university's handling and says, what the hell are you doing? The inquiry was far too superficial. It just kind of I'm not going to call it a cover-up necessarily, because, that would be alleging something, but he at least said it was far too superficial. They finally convict him in the Illinois poisonings that were non-fatal, and he served 2 years of a 5-year sentence. In 1987, he's released from prison. Now, okay, when was that? 1987. So in 1992, he gets a residency at a university hospital in Sioux Falls, South Dakota, using forged documents. And healthy patients die. His past becomes known. He's fired. Then he uses more forgeries, hired as a psychiatry resident, State University of New York at Stony Brook, and he goes to the VA. And his past again comes out, and he's fired. Now, federal investigators get a warrant for him, and he flees to Zimbabwe, where he gets a hospital in Zimbabwe, and the patients start dying mysteriously. He's arrested in Zimbabwe, but goes into hiding. Then he's hired by a hospital in Saudi Arabia, and now he is going to get a visa. So to do that, you got to come back to the U.S., and as soon as he does, he's arrested on federal fraud charges. He pleads guilty, sentenced to 3 years in prison. Now, that was all they could get him on. Sometimes, the feds will say, well, we can't get Al Capone on all this racketeering, but we can get him on tax charges. Another example of that is if you are driving and they get you for drunk driving and you're not wearing your seatbelt and your rear right light is out, they'll cite you for all that stuff to just pile on things so they could get something to stick. And that's what they were doing here. So they get him on these federal fraud charges. And then, he spends 3 years in prison. Days before he's to be released, they charge him with the deaths of the VA hospital patients. They exhumed their bodies and found that they had poison in them. I don't remember what the poison was. I think I talked about it on the Creep Off. So he pleads guilty to 3 New York slayings, sentenced to 3 life sentences without parole. Then, in October of 2000, because now they're really coming after him, he pleads guilty in Columbus to 1984 slaying of Cynthia McGee, a Dublin native who died at University Hospital while recovering from an automobile accident. Goodness gracious. I mean, she looks like she has a very pleasant countenance, and he just apparently killed her. So anyway, this is not a great, it's just a timeline, but he is one of America's most prolific serial killers, and he's one of my colleagues. So there you go. That's Michael Swango. Check out the full story on the Creep Off episode called Concrete Enema. All right. Let's see if we've got anybody in the chat here. I did this as a Patreon, so it is unlisted. So only people in the Patreon. There's Bob Bombington. Says, hey, Doc, after months not being able to catch live shows due to me moving overseas. Oh my goodness, in time difference. Finally caught this one. Oh, I'm sorry. You're catching this one, Bob. While spending a few weeks back in the land of the free. Also, thanks for the Christmas card. Just got it from Held Mail Service. Okay, very good. All right, my friend. Well, I'm very glad that you're back safe and sound in the United States. And let us know what you're doing over there. And wow, so you're just now getting your Christmas card that was sent in November, I think. Anyway, that's awesome. Well, thanks for hanging out. I think Bob's the only one in there. What I do with this, listen, I'm not doing a video show, but for the patrons, I like to do something special. And so I really, this isn't it, but I'm trying to learn how to do this stuff, and I really appreciate it. But I put these out so sporadically that when I make it unlisted, only people that have the link can see it. So a lot of people won't see this link until tomorrow, but I'll just put this immediately up on Patreon. And then in a week, it will go to YouTube members. And then a week after that, it'll go out to the rest of the YouTube audience. Anyway, well, listen, I appreciate you all. Just a quickie today. If you have any questions that you'd like to pose to me, you are welcome to do that on patreon.com/weirdmedicine. We have this mobile thing only, but there are show questions, and then we have a special edition chat. And then you can message me directly on there, and then we have a bunch of exclusive content and stuff. So it's patreon.com/weirdmedicine. A bunch of people got this stupid tattoo, Weird Medicine tattoo. It's temporary. It looks like crap. It's really not good. So I just said, if you want one, just send me an email with your address, and I'll send you one. So I sent out a bunch of those last night. But I appreciate you all. We're going to be live tomorrow, which will be, let me see. Terry Boudreau is here. Okay. Where? I don't know where I got that message from. It's on my watch. It just says Terry Boudreau is here. So the Boud Master is here. Terry, I sent out your tattoo this morning, so you should get it in a few days. Wear it proudly, my friend. I wrote on every single one of the envelopes, prepare to be disappointed. But I'm going to be in Tampa, March 22nd for WATP Live, and I will have a ton of tchotchkes. I've got refrigerator magnets. I've got pins. I've got all kinds of crap. I just give it away. And but you have to come to the VIP meet and greet for that. It's March 22nd. Go to WATPlive.com. And the two winners of the VIP tickets this time were Amanda Davidson and King of All Diffs, whose name is, well, he may not want me to give out his name, but anyway. But I'm looking forward to hanging out with the both of them. And for these live events, just let me know you want to come, and if I can work it out, I can get you a VIP ticket. There are no more for the March 22nd event, though, sadly. I'm also going to be in Dallas April 8th for the eclipse, and then I'll be on Normal World April 9th. And check that out. I'm going to do their eclipse coverage. I'm bringing my solar telescope that will broadcast live images of the eclipse. And in addition, I will be, I'm doing Ask Dr. Steve segment. It's 1 to 2 minutes long, where people send in questions and I answer them in a factual but humorous way. And the first one is on, what's the worst way to die? And I have come up with the worst way to die. And I'm quite confident in my answer. And this would be a medical problem. I mean, there's torture and things like that would be worse than this, but not much. Not much. This one nature came up with. Humans can come up with stuff way worse than what nature does, but this one is for real. So check that out. That'll be on this week, and today is September No, it's not. It's February 16th, 2024. So Normal World, it will be on this week sometime. The first Ask Dr. Steve. And I think they used one of my technical run-throughs rather than the one I wanted them to use. So we'll see how it turns out. But I'll have a little bit more control going forward. And so check those things out. I think those are all my live events coming up. But I appreciate you all and always enjoy being here with you. And if you need anything, just let me know. Take care.
You get nothing. You lose. Good day, sir.